struggles, and she still does, as she works to convince management to create lactation support programs as an RN role separately with bedside nurses. Shelly spearheaded the use of breast milk from donor banks for babies with high risk of intestinal and nutritional catastrophic illness when mothers cannot provide milk for their own infants. The program is amazing and a model for nurses across Minnesota and the nation. Shelly's advocacy has made a huge difference in the lives of thousands of infants, children, and their mothers. Thank you, Shelly, and congratulations.
My heartfelt thanks to the MNA nominating committee and my RN peers for presenting me with your 2015 Creative Nursing Award. I am so touched and humbled to receive this honor that I'm almost speechless. But for those of you that know me, this is a rare occasion. So please allow me to take this opportunity to share with you a bit of the passion that drives my nursing pursuits. I practice as an RN IBCLC, also known as an International Board Certified Lactation Consultant, or Registered Lactation Consultant, and a member of the International Lactation Consultants Association, founded in 1985, as the professional association for lactation consultants and other healthcare professionals who care for breastfeeding families. Our vision is world health transformed through breastfeeding and skilled lactation care, including leadership, advocacy, professional development, and research. Presently, I provide inpatient clinical lactation support in a high-risk pediatric inpatient setting. I am so privileged to have the opportunity to work as part of the healthcare team with mothers and their infants in this very personal and important journey. Today, new data continues to be published almost monthly, which supports that human milk is the finest source of nutrition for human infants. Human milk is filled with immunoglobulins, interferons, and other bacterial substances which colonize the gut, creating a lifelong microbiome for the body. The presence of numerous growth factors, cytokines, gastric hormones, and over 130 types of essential fatty acids come together to provide the perfect nutrition, enhanced neurocognitive development, stronger immune function, and at least a threefold reduction in infectious diseases such as upper airway infections, otitis media, and diarrheal illness. The benefits to breastfeeding women are significant and include a major reduction in bone loss in later life, a reduction in the incidence of breast and ovarian cancer, and reduced blood loss postpartum, as well as a more desirable inter-pregnancy interval. We have all heard the adage, it takes a village to raise a child. This is so true in caring for the family, coping with the frightening and challenging experiences of having an ill newborn. Their days are filled with ups and downs and often uncertainty. The entire healthcare team, in particular the RN, plays a crucial role in providing evidence-based support, including lactation support, to the family engulfed by the crisis of having an ill newborn. In the NICU setting, a mother, given the necessary support and tools, will spend up to 4 hours per day to provide her life-giving milk for her vulnerable infant. The broad support a mother receives from the healthcare team, including lactation support, is central to achieving the best possible outcomes for her infant. Breast milk and breastfeeding for the NICU infant was once unheard, actually discouraged as a mode of infant feeding. Breast milk has become an integral treatment for improving neonatal outcomes for the preterm infant and ill newborn, reducing the risk of necrotizing enterocolitis, retinopathy of prematurity, hospital-acquired infections, chronic lung disease, and creating shorter hospital stays. As you can well imagine, The economic impacts are immense. RNs and the RN lactation consultants are pivotal healthcare providers who can change and shape the future for mothers. Lactation support for mothers and their infants is a burgeoning field, particularly for the maternal child RN. The maternal child RN is in a unique position to provide comprehensive lactation support on a daily basis. This ongoing evidence-based lactation support is vital in supporting women whose goal is to breastfeed to provide their milk to their infant. Here in the U.S., we have much to learn from our ancestors about feeding our infants. We must continue to strive to build systems where mothers have the support for their infants and breastfeeding as the biological norm. We can learn from our neighbors throughout the world about how to support the childbearing and childbearing family to guide every new mother in the early weeks and months following birth. Let us work to enact laws supporting families and children, including paid parental leave, continuing breastfeeding and infant care support long after hospital discharge, employer breastfeeding support, health care benefits throughout the leave, and more flexible and creative work schedules. Even though a variety of evidence indicates that breastfeeding reduces many healthcare risks for mothers and children, numerous barriers to breastfeeding remain. Lack of knowledge about the specific benefits of breastfeeding and the risks associated with formula feeding, postpartum lactation challenges and inadequate follow-up, extremely short intrapartum hospital stays, and lack of follow-up support. Bottle feeding viewed by many as the societal norm. The marketing of formula, contrary to the WHO International Code of Marketing of Breast Milk Substitutes, is not legally binding in the United States. Lack of family and social support, including embarrassment and fear of being stigmatized for breastfeeding around others, lack of paid maternity leave, inflexibility of work hours and locations, fears of job insecurity, lack of privacy for breastfeeding or expressing milk, hospital and clinical practices, including separating mothers and infants, unnecessary formula supplementation, lack of breastfeeding education for staff, fragmented care, and the lack of breastfeeding knowledge of healthcare providers. Creating unique plans of care, accommodating mothers' individual goals, empowers each mother to adapt and change, and sometimes simply take one day at a time. I would like to believe that my ability to think outside the box, to craft ways to help mothers as they adapt to their new reality, has helped mothers meet their parenting goals. Even though they are separated from their infants, born ill or prematurely, finding themselves in unexplored territory, we live in an increasingly complex world where mothers are fashioning new pathways for themselves and shaping the world for future generations. In gratitude, I owe thanks to the mothers and infants who have taught me in my journey to improve my skills in the art and science of nursing and lactation support. Additionally, I'm grateful for my late parents for instilling in me, their 10th child, the value of education, independence, and service to others. I was privileged to have received a Bachelor of Arts in Nursing from the College of St. Scholastica, providing me with a broad-based nursing education, including a curriculum that promoted patient advocacy, self-respect, and the value of lifelong learning. My mentors opened my eyes to the variety of career opportunities and privilege the field of nursing would bring. I am blessed to have worked for 37 years as an RN with colleagues whose expertise and energy, clinical competence, caring, and creativity have allowed me to grow and learn along with them. They have all taught me that to serve others is also to lead. In conclusion, a pediatric nurse touched my life over 50 years ago when caring for me as a child. She had brought me some juice, but she called it circus pop, and I thought how lucky I am to be here in the hospital and to be getting the chance to have circus pop. Caring and creativity are but two attributes of a kindly helper. They are also characteristics of a nurse remembered. Thank you very much for this honor.